Thank you, Chairman Delgado, and thank you, Ranking Member Fishbach, for holding this very important hearing today. And I want to thank also those who are testifying. I'd like to look back to the 2018 Farm Bill for a moment, if I may, and talk about some language that I was able to secure in the Farm Bill through our office to create a rural health liaison position at the USDA. Then last year, we filled the position through the appropriations process. The goal of the rural health liaison is three things. Number one, improve coordination in rural healthcare delivery. Number two, promote awareness on the USDA resources available to help finance the construction of hospitals and telehealth infrastructure. Number three, coordinate with other government agencies or rural health issues. My questions are for Mr. Fox and Mr. Mattson. And Mr. Fox, if you could answer first, and then Mr. Mattson, if you have anything to add on to this, if you could chime in. Given what I just shared with you about the office's duties, how do you feel the rural health liaison can be most valuable in the COVID recovery? Second part of that same question, are there specific areas in the rural healthcare space that could be helped by better federal government coordination? Mr. Fox, if you could go first, please.
Chairman Delgado and Congresswoman, I think anything that can be done to help rural hospitals with the technical piece and being able to move forward on that is very important. The more we can partner and the more we learn from each other, the better off we are. It's just so important. I appreciate what you've done.
Mr. Mattson?
Yes, thank you for the question. I think one thing that was illustrated through COVID crisis, John Maxwell recently quoted, "A crisis doesn't make you, it reveals you." And one of the things that was revealed was the need for coordination of all of the resources that we had, from funding to patient care. We are so geographically disconnected in some respects that the level of coordination in rural spaces was much higher demand and more dragging on our systems than in urban metro concentrated areas. Definitely, we are thinking now about how we're going to recover from the pandemic. The OIG inspector report released on March 23rd that hospitals reporting the COVID-19 public health crisis has significantly strained the healthcare delivery system. I would commend the subcommittee to review that report because it really does accurately capture the pulse of healthcare organizations. And definitely one of the things that we're concerned about is our ability to recover post-COVID, our financial instability from higher costs and lower revenues. We're not sure where our volumes are going to recover. So coordination of funding resources, coordination of the infrastructure build out, and definitely coordination of building out telehealth, not just the infrastructure to deliver the product, but also the electronic medical record. Over the next 5 years, our organization is going to spend about $28.5 million on EPIC, which is our electronic medical record, which helps us take better care of patients. It's a better data resource, but we are required under all of the regulations to have the connectivity, but it is expensive. So getting that product and having funding available for that is equally as important as having funding available to build the buildings and the facilities. So think about $28 million over 5 years. That's a significant spread, and it's an ambulatory surgery center, bricks and mortar equivalent. But the interoperability requirements, which again are a great policy to have, that has to be coordinated again. So it's not just the access, but it's the product that we use to deliver the care that's important to consider equally as much as the broadband solution. But I think that coordinator position would tie a lot of loops that might remain open right now. It would be nice to close those.
Well, I will yield back. Thank you.
Thank you.